Hi, it's Dr. Marty Ross. In this video, learn the best testing you can use to determine if chronic virus infections need to be treated during your treatment of chronic Lyme disease. If you have any questions, click on a link to a written article that I have included in the description for this video. Treat Lyme is supported by purchases you make through Marty Ross MD supplements.
So the problem with virus infections is a lot of doctors will try to determine if you have too many viruses living in you to see if they're a problem by measuring antibody levels. And the antibodies that are generally elevated when somebody has viruses living in them are IgG antibodies, okay? But the problem with viruses is we live with virus, we cohabitate with them, all right? Healthy people have viruses living in them, and it doesn't cause them problems because their immune system keeps it under control, because their immune system makes IgG antibodies, all right? So just having elevated IgG antibodies does not mean one of these viruses that are common even in healthy people are causing the person with Lyme a problem, all right? So those viruses, for instance, would be the Epstein-Barr virus, which is the monovirus, HHV6, which is human herpes virus type 6, something called parvovirus B19 can be one, something called cytomegalovirus. Those are common viruses that some people think could be involved in fatigue and in Lyme disease causing symptoms. But again, it's controversial because they may just be background noise, all right? So there was a study done back in 2012 published by a researcher named Montoya out of Stanford University. He's doing some pretty interesting research on chronic fatigue syndrome these days. And he found that if people had marked elevations of HHV6 IgG antibodies and Epstein-Barr virus IgG antibodies, that he postulated that meant they had chronic active viruses, that they were a problem. And he put all of those patients on a prescription antivirus medicine called Valcyte, and he found an overwhelming number of those, more than half of them, had good improvements in energy by being on Valcyte. And so that was taken as some proof that maybe elevated IgG antibodies does mean that the viruses are active and they're hurting you, okay? But I would say it's still controversial. We really don't know, all right? So where nagalase can come in is it's made by the covering of viruses and can indicate if you have an active viral load in the body. Do you have too many viruses? Now, it's not specific for any one virus, but it can indicate it, okay?